eyebrows on the brow is higher or lower than the other, that means you don't have a very good relationship with your siblings. You have different opinions, you have disagreements, or you're not very close. If your eyebrows are cut or broken, you're like this when you were born. That usually happens to people who have missing siblings. The sibling passed away or had some major injury or gone missing or lost contact, or for some reason you were apart, you didn't grow up together. For people who don't have siblings, this usually means they tend to have problems with their social life, don't have close friends, or they're not very good at making friends. Same goes to people who have very short eyebrows. The eyebrows stop halfway. These people usually either don't have siblings, or they hate their siblings, or they tend to lose their siblings, like passed away or lost contact. Eyebrows also associate with thought process. People with super long eyebrows, the thought process is long. They think a lot, analyze a lot before they make any decisions. Okay, so I think we cover most of the eyebrows type. But for eyebrows, it's not only the hair itself, it's the brow bone also matters. Some people, you almost don't see their bone, it's all flat. But some people, you see huge bones sticking out. Flat bones usually means you're easy to trust people. You're easier to be convinced. While big bone people usually are not easy to fall for what other people say. They would look at you, analyze what you say, then decide. Usually guys have stronger brow bone than girls because girls got softer hearts. They tend to trust people easier than guys do. And if your brow bone is overly poking out, then it means it can be a bit impulsive and aggressive. But no matter how much your bone poking out or not poking out, as long as your eyebrows are good and aligned with your brow bone, then it's always better. So that's the brow bone. Next thing is when you look at someone's eyebrows, you also need to see the combination between the eyes and the brows. If someone's eyes are weak and no focus, but the eyebrows are overly thick, overly strong, thick hair and thick shape, like when you look at someone's face, the first thing you see is not the eyes, it's the eyebrows. The eyebrows are stronger than the eyes, overpower the eyes massively. Then you need to be careful. These people usually are very impulsive, very tactless. They can't control the emotions because our eyebrows are like the assistants of our eyes. They're here to help our eyes. If eyes is the president, then the eyebrows is like the vice president. What happens if the vice president is more powerful than the president? Then the country will fall apart. However, if your eyes are super powerful as well, like dragon eyes, then we say it's super good to have both strong eyes and brows, only if the brows don't overpower the eyes. Relationships between eyes and eyebrows is actually more important than the individual eyes and brows. It shows the balance between them two. Not only this, even the gap between the eyebrows and the eyes is full of knowledge. But I think this episode is too long. Let's talk about that in the next episode. Anyways, eyebrows is like your emotion. Good eyebrows and brow bones means you have good control of yourself. You know what you're doing. You find a lot of criminals, like serial killers, they don't usually have good eyebrows because they fail to control themselves. Like animals. Animals don't have much eyebrows, like 1, 2 hair here. They don't need to control their emotions. But human does. That's the difference. Okay guys, that's all for today. I hope you enjoyed this eyebrows episode. If you want to have your personal face reading with me, you can email me at astroways.info@gmail.com or find me on Facebook at Astroways. If you like my video, please give me a thumbs up. If you want to know more about metaphysics, please subscribe my channel and I'll keep you updated.
Good evening, everyone.
Good evening, Doc.
Okay. So yung gustong mag-share ng link, pwede nyo naman i-invite via Zoom eh. No? Kasi mukhang Ma'am, ano to? Ma'am Gretel, pwede mo namang you can invite your friends via Zoom. I don't have to give you the link. Para ano na, ganun din naman eh.
Okay, Doc, thanks.
Okay, so kasi I still have to look for your mag-invite pa, then mag-umpisa na tayo. Okay, so let's continue with our, kung napansin nyo, ating video is about the eyebrows. So, syempre, part din ito ng ating pag-analyze ng mga tao. Actually, ito yung tinitingnan ko talaga, no? And I'm very fascinated with eyebrows that are arched. Okay, tapos hindi ko rin gusto yung naka-straight lang kasi walang ka-art-art. Yun pala yung mga stubborn. So we will continue discussing the face of Sandra Martin, who is the president of ParaView. So today is our second night, tonight. Okay, so kung titingnan niyo yung left eyebrow po niya, even po siya, ibig sabihin pare-pareho yung thickness throughout the length. And it is also slightly angled. So if we're going to focus on the left eyebrow, which is the personal life, okay, mabilis siyang mag-size up ng situations and hindi siya takot to take an opposing point of view. So yan yung mga tao na hindi duwag, no? Okay, so pag alam nila tama sila, kahit iba yung pananaw ng iba, talagang makikipag-debate. Okay? Next, yung right eyebrow niya, this is yung mukha niya sa public. Kung ang left is personal, yung right is professional. Okay, winged siya, para siyang numipis siya sa may dulo, no? So para siyang naging wing, no? Naging pakpak. Meron din siyang excess hairs sa umpisa na malapit sa ilong. Okay? Ito po, kung kukumpare nyo yung kapal ng kanyang eyebrow, mas makapal po rito. Okay, so this is a good example of how you can see it on the face pag iba yung kanilang mga mental approaches sa personal versus their professional. So kung ang left eyebrow is the personal, the right eyebrow is the professional life. So sa professional life, okay, kung nakikita niyo yung eyebrow niya is parang nagiging pakpak. Okay? She is a realistic visionary with a dual capability of seeing all the fantastic possibilities. And she can also spot potential problems immediately. Okay? So magaling ito sa planning because big ideas are what intrigue her most. So these are the kind of people that you should make friends with, especially if kailangan mo yung tulong nila when it comes to making life decisions. By learning to delegate the details, she can free up her time for more important matters. Okay, I hope that's enough for tonight. Belated happy birthday, Sir Jess.
Thank you, Doc.
Wow. Hindi na namin tatanungin ilan na taon kasi bawal po yun. Importante, healthy tayo. Okay? So, let us now continue with okay, punta tayo sa tongue diagnosis. Last time, we talked about spleen yin deficiency. Ngayong gabi naman, pag-uusapan natin ang lung yin deficiency. Okay? So, pag may problema tayo dyan, talagang inuupo tayo, so kulang tayo sa yin. Okay? Now, pwede pong mag-develop ang lung yin deficiency kung nagkasakit tayo or depende sa constitution ng isang tao, pwede siyang kung meron ka ng pre-existing kidney yin deficiency. Okay? So alam naman natin na mag-ina po ang lung and kidney. The important causative factor ng isolated lung yin deficiency is smoking. Ibig sabihin kung nagkaroon ka ng lung yin deficiency na wala namang problema yung kidney mo, hindi wala ka namang kidney yin deficiency, posibleng dahil po ito sa smoking. And smoking generates heat in the lungs. And pag mayroon pong heat, nagka-clump po yung lung fluids. So meron po tayong tinatawag na smoker's cough. Okay, so kung smoker po, I think you know what I'm talking about. You would usually cough typically in the morning and meron kang phlegm na thick and discolored. Okay? So pag matagal ka na naninigarilyo, marami na pong taon, this will lead to dry cough or irritating cough. And the cause of this is yung discolored na phlegm nagda-dry up na po. So ang heat sa lungs, nakikita po natin ito sa anterior third of the tongue. So if you're going to take a look at the picture here, red po yung anterior third niya. Okay? Pag advanced stage na po ng injury sa lung yin, magkakaroon na po ito ng thin cracks. Okay? And the color of the tongue body is red. So pag matagal ka nang nagtatrabaho sa isang lugar na matuyo tapos maalikabok, this can also cause lung yin deficiency. A very good example of this would be bakers and miners. Okay? Yon. Lung yin pwede na ma-injure because of external dryness, lalo na pag masyadong mainit, katulad ngayon, extremely dry weather, or meron kayong central heating and air conditioning. So meron kang dry cough, dry throat, or mouth. So ang lung yin deficiency is manifested as hoarseness na mamaos, okay, itchiness or throat. Okay, I have one teacher in Spanish before in college. I remember parating paus yung boses niya. And nabalitaan ko na lang namatay siya lung cancer. Okay? So yun. Kaya wag nating masyadong, we have to make sure na yung boses natin hindi po paus. Okay? So pag meron tayong lung yin deficiency, we have hoarseness. Pwedeng nangangati yung ating lalamunan. Okay, meron tayong blood-tinged sputum because of the heat, and you will feel hot in the body. Or meron tayong subfebrile temperatures in the afternoon. Kaya very typical of lung yin deficiency. If you remember, pag meron po tayong yin deficiency, medyo para tayong mainit yung pakiramdam natin, lalo na sa hapon. And usually the patient will tell you, bakit parang nag-fever ako, although hindi naman siya mataas masyado pagdating ng hapon. So dry din po yung tongue. Okay, so pag yung tongue body is intense red na po, yung discoloration, meron na po tayong lung and kidney yin deficiency. So yung mga teachers, singers, and actors, most of them will have lung qi or yin deficiency. Overuse of the voice, humihina po yung ating tinatawag na gathering qi or zong qi. Okay? Energy po na ito yung nagko-control ng strength ng voice. So for those people na medyo mahina na yung boses, you have to probably look at the possibility na meron na po tayong gathering qi or zong qi deficiency. Kasi ang zong qi influences speech because it supports the qi of the heart and lungs. So ano po ang early signs ng gathering qi deficiency? Meron po tayong depression sa anterior third of the tongue and pale tongue body kasi nga deficiency. So pag medyo may bumabaon na, depression in the anterior third of the tongue, that is gathering qi deficiency. And madali din sila mag-catch ng colds. Okay? At saka may problema sila sa boses nila. So, meron din sila mga symptoms that will indicate heart and lung qi deficiency. So, nakikita po ito sa mga tao na merong long-standing sadness and grief. Kaya dapat nag-move on na tayo. Otherwise, magkakaproblema talaga. No? Sadness, dinidisperse niya po yung lung qi and pinapahina niya po yung ating heart qi. So pag unresolved po yan for many years, yung lung qi deficiency natin nag-i-evolve into lung yin deficiency. So pag yung tongue natin is red at saka marami ng maliliit na cracks, plus merong depression sa anterior third, so meron na po tayong onset of lung yin deficiency. Okay? So pula na yung dila, may mga maliliit na crack, plus bumabaon na, onset po yan of lung yin deficiency. So yung mga pasyente na may stomach yin deficiency, karamihan sa kanila will also show signs of lung yin deficiency. So pag naubos na-injure na or na-exhaust na yung stomach fluids, yung lung yin will be undernourished. Stomach yin deficiency that leads to lung yin deficiency is reflected in a vertical crack sa midline of the tongue and meron po tayong maliliit na cracks sa anterior third. Okay, so yung mga frequent illness that is caused by winged heat, katulad ng meron kang ubo na parang kang kumakahol, or meron kang sore throat parate, this can lead to lung yin deficiency. Kasi persistent, long-lasting cough can injure the lung qi, and so eventually magkakaroon ka rin ng lung yin deficiency. In feverish illnesses, pag yung init, yung heat, nag-enter na po sa qi level, and then naglinger sa lung and stomach, yung anterior third of the tongue, so remember, pag pumasok na po sa qi level, magkakaroon na po ng heat, no? And magkakaroon tayo ng red points. So ang ibig sabihin nito, meron po tayong toxic heat or heat sa lungs. So meron tayong lung yin deficiency because heat will injure the fluids in stomach and lung. Okay? So meron tayong mga specific tongue signs that will indicate lung yin deficiency. Now let's go to our cases. Okay, meron tayong 31-year-old female. Kung titingnan nyo mabuti, maputla yung dila niya, may mga teeth marks. Okay, tapos may vertical crack siya sa anterior third. So, isip ka agad natin is lung yin deficiency. Tapos may red points sa may dulo. So, red points, siguro meron na po siyang heat sa heart, no? Or toxic heat. Tapos yung coating niya, white and greasy. Okay, what is that telling us? So, white, greasy coating, ibig sabihin sa stomach siya, no? Probably food retention. Diba? Kasi pag greasy yung coating, ibig sabihin, hindi po natunaw, no? So, dry mouth at night, so yan pa lang, nagpapakita na dry skin. Dry skin, lungs talaga, definitely. Constipation, dryness din, bloated abdomen. So, walang Western diagnosis. Meron po siyang long-lasting pertussis 1 year ago and overwork and smoking. So, ito po yung TCM diagnosis. Kung napansin nyo, okay, onset pa lang ng lung yin deficiency. Okay, and may heat sa upper burner, food stagnation, yes, dahil po sa greasy coating na white, and spleen qi deficiency. Okay? Kasi po meron siyang mga teeth marks, okay, and this is blood deficiency. So, punta tayo ng case history ng patient. Isa po siyang journalist. Nag-contract po siya a year ago ng pertussis. Pertussis is whooping cough. Hindi siya nag-react well sa mga conventional treatment. So for weeks, nag-suffer siya with coughing fits. She continued to smoke during the illness. So since then, yung skin niya is very dry, very constipated siya with dry stools. Nag-complain din siya ng bloated abdomen. Pag bloated yung abdomen natin, that is a sign of spleen deficiency. The tongue body was pale, meron pong crack sa anterior portion, and the pulse was noticeably choppy. Choppy means blood deficiency. Mrs. S was very healthy until she contracted pertussis. Okay? Kaya nakita natin na normal yung tongue shape and yung pale tongue, pati yung choppy pulse indicate blood deficiency. So yung white greasy tongue coating niya, ang ibig sabihin po nito, may food stagnation dahil meron siyang hectic eating habits at work. So pagkatapos siguro niya kumain, uh, nagtatrabaho ka agad. Food stagnation kasi this will disrupt the downward moving actions ng stomach chi. So nagkakos siya ng abdominal distension. The constipation was due to lack of blood to moisten the intestines plus lack of descending stomach chi. So yung vertical crack sa anterior third, okay, dahil po ito sa kanyang pertussis and persistent coughing fits, both injured the lung yin. So patuloy pa rin siya naninigarilyo kaya nagkaroon ng heat sa lung. And yung lung yin deficiency, nagmanifest siya as dryness. Kaya meron siyang dry mouth, dry skin, and dry stools. Punta naman tayo sa 38-year-old female. Okay. Yung tongue niya is reddish. Pagkatapos, makapal, rough, magaspang yung tongue surface niya. Red yung edges. So dyan pa lang, pag sinabi nating red ang edges, we will already think of heat in the liver. Deep irregular crack in the anterior third. So malalim na po. That's probably lung yin deficiency. Deep red spots at the tip. So that could be heat in the heart. Yellow thick greasy coating, especially sa root. That's damp heat, no? Lower burner. So let's take a look at the symptoms. Difficulty breathing, dry mouth, thirst, night sweat. So definitely mayroon yin deficiency. Restlessness, tendency to catch colds. Okay, Western diagnosis niya, chronic tonsillitis with abscesses of the crypts. Meron siyang allergic rhinitis and bronchial asthma. Background, repressed emotions. Kinikimkim niya yung emotions niya, especially grief and feelings of guilt due to having given birth to a handicapped child. And then meron silang lahi, may family history sila of respiratory diseases. So dahil, okay, diagnosis, andito na po, onset of kidney yin deficiency, ibig sabihin, dahil yellow na, yung coating na po, no, sa yellow na yung coating, heat in the liver, the red sides, lung yin deficiency, the deep crack in the anterior third, long-standing retention of toxic heat, that's the presence of dots there, and accumulation of damp heat in the lower burner. So ito po yung case history ng patient. She appears exhausted. She looked after her physically and mentally handicapped child. Ang hirap kaya mag-alaga ng bata na PWD. Okay. Night and day. Her marriage had become strained because kukunti na lang yung time niya with her husband. So meron po siyang sadness, feelings of guilt, and deep-seated anger. So as we have learned kanina, this can cause lung yin deficiency. For months, she suffered from restlessness and night sweats. After emotional stress or physical exertion, meron siyang tightness sa chest and difficulty breathing. She was susceptible to cold, suffered from frequent tonsillitis. So unable na siya to cope with tasks of her life. Yung tongue coating niya was yellow and greasy, especially sa posterior third. Meron po tayong deep irregular vertical crack in the anterior third of the tongue. Yung tip ng tongue niya, meron dark red spots. Yung edge ng tongue, red. Pulse niya was rapid and wiry. So yung unresolved emotions niya, ito yung nagpa-red ng sides, kaya meron po tayong liver chi constraint na nag-deteriorate into heat in the liver. So nakikita po ito sa red edge ng tongue and wiry quality ng pulse. Yung kanyang long-standing sadness, nasira po yung lung chi and yin, kaya nagkaroon ng asthmatic attacks. Okay? So yung mga medyo matagal na po ang sadness, pwede pong lumala yung asthma nyo. Sa hindi na kasi bagay asthma at medyo maedad na, no? So the tongue reflects both of these pathologies quite clearly. The red edges, nagpapakita ng liver heat. Yung deep vertical crack in the anterior third indicates lung yin deficiency. So yung lung qi and lung yin deficiency contributed to her tendency to catch colds. Kaya meron po siyang sore throats, inflamed, swollen tonsils. Yung dark red points at tip of the tongue reflect toxic heat, which was retained in chronically inflamed tonsils. So yung kanyang underlying kidney yin deficiency, ito po yung nagbigay ng heat, kaya meron siyang night sweats. Samantala, yung heat sa liver, nag-contribute po siya sa accumulation of heat in the interior. So yung mga heat na to, ito po yung nag-deplete ng fluids, kaya nagkaroon siya ng dry mouth and intense thirst. Yung greasy yellow coating sa posterior third reflects damp heat in the lower burner, which has not yet caused any corresponding symptoms in the patient. So pag meron po tayong lung deficiency, this will always lead to dryness and the heat from deficiency. Okay? So dryness and heat from deficiency. This will be reflected in changes in the anterior third of the tongue. So may redness, dryness, and cracks. Appearance of these signs should be a signal para mag-abstain na tayo from eating spicy, hot foods and herbs, and also from smoking. Kasi lahat po ng ito will have a drying and heating effect on the body. Ang problema lang, meron na ngang lung yin deficiency, naninigarilyo pa. So, good luck na lang. Okay? So, any questions? Okay, punta na po tayo sa ating case. Thank you kay Ma'am Roxanne for submitting another another patient's tongue. Okay? Okay, so we have a 43-year-old female. Anybody would like to comment? Yung chief complaint niya, stiff neck, shoulder pain, at saka may sciatica. Okay? Nagka-COVID siya noong September 13. Oh, tapos diretso ka agad nag-first dose. September 16. Bilis. Bakit to ganito? Parang, di ba dapat wala mo ng COVID bago mag-vaccine? Ano ito siya? May anak na? Anong itsura ng paa niya? Kasi meron siyang APAS, anti-phospholipid syndrome. Hindi, ang ano kasi niyan, you don't necessarily have to have those signs, no? Ewan ko pa paano. Kumusta yung panganganak ng kanyang mga anak? Was it traumatic? Actually, ang cause kung bakit naging malapot yung dugo niya is because of this syndrome. So let's talk a little bit about this syndrome. Wait lang. I think I have this in mind. Bakit nawala? Wait lang po.
Hello everyone, good evening. Nakikita nyo ba? Kanina pa ako wala nakikita sa screen.
Good evening.
Nakikita kayo?
My screen.
Aaron.
Ng foundation na started screen sharing lang yung nakikita ko dito, tsaka boses ni Doc. Internet connection ko siguro nga, no? Sige, okay. Makikinig na lang ako. Kikinig na lang ako.
Itong anti-phospholipid syndrome, nag-produce ka ng antibodies against your blood cells. Kaya lumapot po siya. One of the components kasi ng dugo natin is yung mga phospholipid. Okay? So, nag-create ka ng antibodies. So, pag nag-create ka ng antibodies, nagre-react. So, nagkakaroon ka ng thrombus. And usually, nangyayari, very common yan sa mga babae. And I think this is the reason why meron na siyang sciatica, meron pa siyang shoulder pain ba yun? Stiff neck, yeah. So all types of pain. Actually connected lahat yan. Even the shoulder is connected here. So usually sa mga babae, nagkakaroon ng problema dito. So nagkakaroon ka ng mga clots dyan. Okay? So yung anti-phospholipid antibodies, okay, ginagawa nila yung dugo na very thick, hypercoagulable. So ang solution dito para matulungan ng pasyente, bibigyan ka ng blood thinners. Pero I still think na we have to do something about the antibodies. Bakit? Sa immune system niya talaga. And when you talk about the immune system, andito na po papasok yung balancing the yin and yang of the kidneys. Okay? So, sa mga babae, common po yung venous thrombosis. Okay? So, medyo maitim yung ng legs niya o yung paa niya. Okay? Sa mga lalaki naman, arterial thrombosis which can cause heart attack, stroke, or limb ischemia. And nakakatakot po dito is pag nagkaroon ng pulmonary embolism. Kasi pag meron po kayong clot, okay, so pwedeng mag-dislodge yung clot, nagiging wandering clot siya. Ang tawag ko doon is already embolus, no? Kaya pag nagta-travel na po yung blood clot. So ito po yung risk. Pag binigyan mo ng gamot yan para matunaw yung clot, the clot will break up into small components. So these are called the embolus or emboli, plural. And the emboli can, we look for the area that is medyo titigil lang siya pag medyo nakahanap na siya ng vein na medyo maliliit, and this is the pulmonary circulation. Okay? Gusto ko lang malaman kung I think this is kaya ito yung comorbidity niya. And ang nangyari, I think nag-trigger po yung kanyang kasi hindi naman talaga dapat tinatago ito, no? So parang double kill ang nangyari. So kaya lumala, nagkaroon ng coagulation lalo. So a synonym for APS or antiphospholipid antibody syndrome is U syndrome. So para ma-diagnose ka na meron ka nun, dapat merong clinical event. So kaya tinatanong ko kung yung pregnancy ba niya was a bit traumatic. No? Kasi kung mahirap yung pregnancy, pwede magkaroon ng thrombosis. And the persistent presence of the antibody, which is the antiphospholipid antibody. And this is more common in women in the ratio of 5:1. So 5 women, 1 man. 5, okay. Yon. Females, more frequently, they will have arthritis. I think this is the reason why meron siyang shoulder pain. Okay? Meron din siyang sciatica. Sa mga males naman, usually yung heart yung may kasi arterial myocardial infarction. Mean age of onset is 31 years, but I think our patient is already 40 plus. And so yun, meron po tayong kasi dalawang klase ng ATLS, idiopathic or primary, ibig sabihin, hindi natin alam kung saan nagmula, bakit ganon. Secondary, dahil po meron po siyang dati ng mga autoimmune disorders katulad ng SLE and rheumatoid arthritis. So usually, ganito po yung kanilang mga legs, no? Okay, usually kasi sa babae yung paa ang affected. Any comments? May nakikita na po kayong sana yung si Miss Unstoppable.
Nandito ako.
Mm-hmm. Okay. Yes. Actually, una-una yung tongue niya talaga purple na purple. And kung titignan nyo, napakakapal ng coating, especially sa posterior third. No? And marami po tayong toxic heat. So, ibig sabihin talagang may nangyayaring hindi maganda. Okay? Ano pa ba? So, itong dito, yung sides niya, kung nakikita nyo, plus ito, ano ba to? Baka yung pagkuha lang. At saka, I think we really have to check her heart also. Any comments? Ay, bakit walang comment? Sinong gusto mag-analyze?
I cannot analyze, I do not see anything in my screen. Only the black screen with lump foundation has started screen sharing until now.
Okay. Bakit yung iba na nakakakita?
Ewan ko, mahina siguro masyado signal ko kasi kanina may tumawag, putol-putol, broken in words.
Okay, pa-analyze natin kay Ma'am Betty. Any comment, Ma'am Betty?
Coating, Dok.
Super kapal coating, no?
Yes.
I think we need to really check her kidneys. Hindi po maganda yung kulay ng tongue niya. Yung coating, napakakapal. There's a lot of dampness, di ba?
Yes.
At saka maraming tingnan nyo yung mga, ito na yung prickles na,
Yes,
ito na yung spots. Super heat.
Dami.
Oo. So talagang hindi po maganda. I think, I do not, September pa naman siya no? Pero ganito po kasi, meron na po kasi siyang heat. So sana inantay muna niya na gumaling siya sa COVID. Ang nangyari, nag-trigger. So pag may heat kasi, nagkakaroon ng imbalance. Um, so kung talagang na-diagnose ito na may antiphospholipid syndrome, most likely meron po itong ibang autoimmune disease katulad ng rheumatoid arthritis and lupus, no? So yun. Kaya so ang gagawin natin, ang dami talaga niyang phlegm, di ba, madam?
Para na-suppress yung heat sa loob, no?
Mm-hmm. Meron na ng phlegm heat eh. Parang this is like phlegm heat already.
Kapal.
Saka kung titingnan niyo yung kanyang lungs, talagang depressed na po, di ba? Oo.
Opo.
Saka, di ba, pag marami tayong nakikita mga puti, mga pula-pula, sign of toxicity. So, how is the patient now, Ma'am Roxanne? So definitely, meron talaga siyang blood stasis, no? And because probably of her antiphospholipid syndrome, lumala po talaga kasi yung dugo. Kaya syempre, pag walang movement, nag-generate siya ng heat. Kaya yon, nagkaroon ng toxic heat tuloy. So I hope we can help her by giving Miramin Q or Quantumin. Kasi we need to have a change sa kanyang coating. Napakakapal ng coating. Alam naman natin na pag makapal yung coating, there is something wrong with the transformation of food into chi. No? Okay, so hindi siya natatransform mabuti. Okay? So yun. And then, yung dampness niya, nagkaroon na ng phlegm. Although, parang I see a little, parang stiff yung kanyang tongue. No? Kasi siyang meron yung mabuti, the presence of the spots here or the prickles will indicate that there's a lot of heat already. No? So pwede nating sabihin na meron na po siyang blood stasis and heat sa buong katawan niya. And that is giving us the problem. Blood stasis definitely, ito yung nag-cause ng stiff neck, shoulder pain, sciatica. And kung titingnan mo yung kidney niya, kidney area talagang hindi maganda. No? So actually yung mga prickles, it's all over the body, all over the tongue.
Yes.
So what we should do aside from your therapy, we have to recommend detoxification. Okay? So maraming salamat po. Okay, any questions? Saan na yung di nakikita yung ating sinishare? Ma'am, Unstoppable.
Ang dami pa naman natin. Pero di bali basta nakikita ng iba. Happy ako na napakarami natin ngayong gabi. At ang dami ding natutunan sa diniscuss mo kanina.
Oh, ito ba yung si Joanna na nag-join before?
Anak man siguro to naman Betty, see?
Yeah.
Good evening. I'm Joanna. Good evening. Welcome.
Joanna, mahilig pa rin sa milk tea. Tingnan natin yung...
Sinupana po.
Ay, wala na. Wow, congratulations.
Thank you. Papasalamat siya sa inyo, Doc.
Kumusta na po yung dila niya, ma'am?
Hindi pa na screen siya.
Sige, para makompare natin, no? Para okay naman. Medyo okay na.
Salamat.
Sir Jeffrey is... Hello po, Sir Jeffrey. Okay. Anyway, sige, maraming salamat, Ma'am Roxanne. I hope matulungan natin yung patient mo. Kasi meron po siyang autoimmune disorder and hindi po maganda yun. Okay? And I hope we can check her tongue again sometime soon. Good luck po, Ma'am Roxanne, and keep the pictures coming. Parting words, Miss Unstoppable, kahit hindi mo kami nakikita.
Nako, thank you so much. Unang-una kay Doc Hex. Thank you kay Ma'am Betty, kay Miss Texas. Good morning. Kay Sir Jeffrey, kay Sir Jess, kay Ma'am Joanna. Ma'am, thanks for coming also. Miss May, Mrs. Ma'am Roxanne, and Doc Vads. Maraming salamat for joining with us always, and hope na nasa mabuting kalagayan tayo. Bababa naman na yung COVID, though marami pa rin cases sa atin sa Iligan. Ma'am Roxanne, no?
Ay, kumusta po si Ma'am May? Kumusta na ang Iligan?
Okay lang po.
Okay, so let's celebrate. I hope the pandemic will end very soon.
Thank you, Doc.
Good luck. Good night, everyone.
Good night. Stay safe.
Keep safe, everyone. Yeah, see you
Thank you.
tomorrow. Hopefully,
Bye.
makikita ko na kayo bukas.
In East Texas. Good morning in Texas.
Morning.
Bye-bye.
Good night, everyone. Thanks for
Bye.
sharing, Doc.
Bye. Ingat.